Fox News Chicago at 9. Building a better body. Up next, 3 surgical procedures that are giving men and women a boost. One of them, it's called the Brazilian butt lift. Margaret Shortridge reports when we come right back. You read it. Oh.
No.
Oh, I have to read that part? Okay, having a large derriere has not always been considered an asset.
That was not so hard.
All right.
Some well-endowed celebrities, you don't like big, never mind, have brought back the bodacious booty. Now just about anyone that wants one can have one.
Can you see me blushing underneath the makeup? Medical reporter Margaret Shortridge here with the trend gaining popularity with women and, surprisingly, men.
Americans spent more than $10 million on buttock augmentation just last year. Tonight, we're looking at the surgical procedures available for increasing your backside and what consumers need to know before choosing these options. Music videos featuring celebrities like Beyonce and J-Lo are making bodacious buns the hot new beauty enhancement. But if you're not born with the bootylicious buns, you can still get them. Adelaida Gamboa had 2 procedures, a fat transfer and buttock implants, done to enhance her backside.
I do exercise and everything, but they're not enough. I don't feel comfortable in myself.
Her doctor, plastic surgeon Gregory Wiener, says he's seen an increase in both women and men who want to increase the shape of their buttock.
I would say 75% women, 25% men. And the men, typically the same reason, is basically a buttock that has either lost volume or is flattened.
There are 3 types of surgical procedures available. The first and most popular is called fat transfer, or the Brazilian butt lift.
That is done by liposuctioning some fat from somewhere else in the body. Usually it's done from the hip area, because with the hip area you can actually contour the hip and buttock at the same time.
The second option is inserting buttock implants under the buttock muscle.
Those patients actually want a little bit more volume. They want a little bit more that can be achieved with just fat transplantation.
The implants come in a variety of shapes and sizes, like these oval and teardrop shapes.
These are made of a solid silicone elastomer, so it's a solid implant, but it has a very spongy texture and feel to it.
The third option is a buttock lift, which has increased with the popularity of gastric bypass and bariatric surgeries.
You're physically lifting up the buttock skin. Typically those patients are patients who have lost a lot of weight and the skin is just sagging.
No matter which procedure you choose, Dr. Julius Few from the American Society for Aesthetic Plastic Surgery says it's important to have realistic expectations.
Everybody's different. Everybody has different potential, and so if somebody's wanting to go from almost nothing to everything, that may not be possible.
But Gamboa found her perfect fit possible.
Now I wear a dress and I feel comfortable and I look good.
Now the buttock implants and lifts cost about $4,000 to $5,000, while the fat transfer procedure could cost you a little bit less, about $3,000 to $4,000. Margaret Shortridge, Fox News, Chicago.